My name is Lakshmi Devasetti. I'm a practicing vitreoretina surgeon. I deal with the retina, anything to do with the retina, whether it's macular degeneration or diabetes or retinal detachments. We do surgeries for retinal detachments. That can involve doing a scleral buckle or endolaser, along with either fluid gas exchange or silicone oil placement to flatten the retina. We also operate on diabetic retinal detachments. Those tend to be a little more complicated, but along the same realm. We use laser and gas fluid exchange to try to flatten out the retina. With the macular degeneration patients, they don't typically require surgery, but if they did, it would be to inject subretinal TPA to break up the blood that's in the macula and to displace it with an air bubble. Most of the patients tend to come from optometrists that are in the area, that they went in through a routine eye exam and found a problem, found an issue that needs a retinal specialist, and they tend to come here. The other patients come from other ophthalmology groups, general ophthalmologists in the area, who have found either a wet macular degeneration in the patient who they've been following for years and has suddenly changed and requires further treatment. They tend to send them over. Or if they have an acute issue like a retinal detachment or a tear, they tend to send over, and we take care of it here. Most of the times patients tend to search for floaters. If they tend to see black spots in their vision, then they would go online and they would look at floaters or flashes of light that they might experience. That triggers an immediate reaction to figure out if they have a retinal detachment or a retinal tear that's happening. So those are things that people are acutely aware of, and they tend to look online for that. The other stuff, it's kind of hard to say because you need a little more education to really know what to search for, like a macular hole or an epiretinal membrane. But most of the Google searches happen usually with floaters. It's a very fascinating time to be in retina. You didn't have treatments that you had before, and you have the anti-VEGF treatments, the injections, the lasers, the different types of surgeries that we have available now that we didn't have 20 years back. And I think it's a fascinating time to be in it and to learn. The benefit is that if you tend to present here, it's sort of like one-stop shop. You have a retinal specialist who can take care of you. You also, if you're coming from an optometrist, then you have an ophthalmologist here who can do your cataracts, and somebody who can manage your glaucoma, or cornea specialist that we actually employ as well. So there's all different specialties under one roof. And you have a surgery center. You also have optometrists here that can help with your refraction and also getting you the necessary glasses that you need. So it's sort of all-encompassing, I guess. And when you come here, you have a way of, you don't have to go anywhere else, essentially.